anxiety. So there's data, you know, I want to, this isn't just about what's been published in the scientific literature. I'm very happy to share my clinical experience as well, which is that a lot of people who use CBD to treat anxiety report that once they get to a high enough dose, they experience a decrease in anxiety without the side effects that are typical from regular anxiety medications like sedation and confusion and things like that. They feel like they can remain mentally sharp and focused without the anxiety. And that's really a great distinction between CBD and some of the other treatments. So this was a case series, so not a randomized controlled trial, but I think this is very typical of what I see in the clinic. 72 adults at an outpatient psychiatry clinic were taking CBD, most of them 25 milligrams a day in capsule form. In 57 patients, anxiety decreased and remained decreased for the rest of the study duration, which was, I think, around 6 months. And then sleep improved in the first month for about half of the patients, but then fluctuated over time. So it seemed like the benefits of this fairly low dose of CBD, 25 milligrams a day on anxiety, were a very high response rate. So about 80% of people with anxiety that tried this 25 milligram dose had an improvement that they reported in their anxiety, and that improvement was maintained over time. And I also see that in the clinic. When someone responds to CBD, I typically don't see them building tolerance or losing efficacy over time. Now, this hasn't been published, but this is data that was presented at a conference that I wanted to share because it was just 4 weeks of treatment with a CBD dominant product that was produced by the National Institute of Drug Abuse, a full spectrum so-called CBD product, but we never learned any more about what was actually in it. But it was, again, a low dose, 10 milligrams TID, which means 3 times daily. So these were patients with anxiety that were just taking 10 milligrams 3 times daily. And overall, there was an 80% reduction in anxiety over the course of 4 weeks. There were also improvements in depression and mood and improvements in many cognitive domains. So this researcher, Stacy Gruber, does a lot of cognitive tests to assess how sharp people are thinking and how fast they can learn. And so almost every cognitive domain improved and anxiety got better. There was just one test where there was a very small detriment in learning ability. And it was barely measurable, but the general direction was an improvement in cognition. They continued for 6 months. They maintained their benefits for 6 months. They also had improvements in sleep and quality of life with no adverse effects. CBD is incredibly forgiving. And at 10 milligrams 3 times a day, very few people are ever going to have an adverse effect from this treatment. Now, there's been some studies that have looked at very high doses of CBD for treating anxiety, and I just wanted to show you one of those because a lot of people are thinking in the double digits, and that's what most people can afford. But also these really high doses of CBD can be safe and effective. But what's really interesting is the dose response curve. So this was a study where they take people and they make them do public speaking, and it causes anxiousness. And basically that anxiousness is measured on this scale here. And then this is basically before, during the preparation, during the speaking, and afterwards. And the levels of anxiety went up for everyone while they were doing the public speaking. But looking at the data, there were 3 doses of CBD given, 100 milligrams, 300 and 900 milligrams. And what you can see here is that 300 milligrams significantly outperformed both the 100 and the 900 milligram doses. 300 milligrams actually outperformed clonazepam, which is a benzodiazepine, very strong anti-anxiety medication. So I bring this up to show you that more is not always better. And there might be some of these so-called U-shaped dose response curves, even in the lower dose range. And so for someone that's using CBD, if they increase the dose and they get a better effect, especially with anxiety, they increase the dose again and they get an even better effect, and then they increase the dose again and the effect seems to start to diminish, increase it again, and they're not getting the results they were once getting. They've probably gone too high. And just like with THC, sometimes by lowering the dose, you can actually get a stronger therapeutic effect. It doesn't make a lot of sense when people think about it. They think, oh, I should take more and I'll get a stronger effect. But sometimes taking less produces a stronger effect.